If you're over 50 and you've noticed that your mornings start with a trip to the bathroom, maybe two, maybe three, before you even get your shoes on, then I want you to stay right here. Because what I'm about to share with you could genuinely change the way you feel every single day. I'm not talking about a miracle cure, and I'm not going to make you any wild promises. What I am going to do is walk you through something simple, backed by real science, that thousands of men over 50 are quietly adding to their morning coffee, and the difference it's making to their prostate health, their energy, and their quality of life is something I think every man deserves to know about. My name is Dr. James, and for over 2 decades I've worked with men navigating the very real, very frustrating challenges that come with getting older. And one of the biggest ones, the one that doesn't get talked about nearly enough, is prostate health. So today, I'm dedicating this entire video to you, to the man who wants to feel like himself again, to the man who's tired of waking up 4 times a night, to the man who just wants to enjoy his morning coffee without worrying about what comes next. Before I get into everything, I want to ask you something, and I genuinely want to hear from you in the comments below. How many times do you wake up at night to use the bathroom? Is it once? Twice? More than that? Drop your number in the comments right now. You'd be surprised how many men are going through exactly what you're going through, and sometimes just knowing that helps. So go ahead, leave a comment, and let's start this conversation together. Now, let's talk about what's really going on. Once a man hits 50, the prostate, that small, walnut-sized gland sitting just below the bladder, starts to change. It begins to enlarge. This is incredibly common. In fact, by the time a man reaches 60, more than half of all men have some degree of prostate enlargement. By 80, that number climbs to nearly 90%. It's called benign prostatic hyperplasia, or BPH, and while it's not cancer, it is genuinely disruptive to your life. It means urgency, frequency, weak urine flow, interrupted sleep, and a kind of low-level anxiety that follows you around all day. And here's what frustrates me as a doctor. So many men just accept this as part of aging. They think, well, this is just what happens. But that's not the whole truth. Yes, age plays a role. Yes, hormones play a role. But so does inflammation. So does oxidative stress. So does nutrition. And that means there are things you can do, real, evidence-based things, that support your prostate health and help you feel better. That's what this video is about. So what exactly are we putting in that morning coffee? I'm going to walk you through a handful of natural ingredients, not random internet supplements, but compounds that have been studied seriously and shown genuine promise for prostate health. And the beautiful thing is, most of these can be stirred right into your morning cup without changing the taste you love. The first one I want to talk about is saw palmetto extract. Now, if you've done any research on prostate health, you've probably come across saw palmetto. It comes from the fruit of a small palm tree native to the southeastern United States, and it's been used for well over 100 years to support urinary and prostate health. But what does the science actually say? Multiple clinical studies have looked at saw palmetto's effect on men with BPH, and what they've found is genuinely encouraging. It appears to work by inhibiting the conversion of testosterone into dihydrotestosterone, DHT, which is one of the key hormones that drives prostate tissue growth. When you reduce excess DHT activity at the prostate level, you can reduce some of the pressure and urgency that comes with an enlarged prostate. Several studies have shown improvements in urinary flow, reductions in nighttime urination, and better overall quality of life for men who take saw palmetto regularly. Now, it's not magic, and results vary from person to person, but for a natural compound, the evidence is solid enough that many urologists in Europe have been recommending it for decades. You can find saw palmetto in capsule form or as a liquid extract, and a small amount of the liquid can be added directly to your morning coffee. It's nearly tasteless, and it dissolves well in a hot drink. The second ingredient I want to talk about is pumpkin seed oil. And I know what you might be thinking, pumpkin seed oil in coffee? But bear with me because this one is remarkable. Pumpkin seeds are one of the richest natural sources of zinc, and zinc is absolutely critical for prostate health. The prostate gland contains one of the highest concentrations of zinc of any tissue in the entire body. Zinc plays a role in regulating cell growth, supporting immune function, and modulating hormone activity. Studies have shown that men with prostate issues often have significantly lower zinc levels in their prostate tissue. Pumpkin seed oil also contains phytosterols, particularly beta-cytosterol, which have been shown in clinical research to improve urinary symptoms associated with BPH. One well-cited study found that men who took pumpkin seed oil over a 12-month period experienced significant improvements in their International Prostate Symptom Score, the standard clinical measure for urinary symptoms. Their quality of life scores improved. Their nighttime bathroom trips decreased. These are real, meaningful outcomes for real men. A teaspoon of high-quality pumpkin seed oil has a mild, nutty flavor that actually complements coffee beautifully. You can stir it right in, add a little to your creamer, or blend it in if you make a bulletproof-style coffee. Now let's talk about something that might surprise you: green tea extract. Specifically, the compound EGCG, which stands for epigallocatechin gallate. I know that's a mouthful, but what it does is worth knowing. EGCG is one of the most powerful antioxidants found in nature, and antioxidants matter enormously when it comes to prostate health. Here's why. Chronic low-level inflammation and oxidative stress are now understood to be major contributors not just to BPH, but to prostate cell dysfunction in general. When free radicals, unstable molecules produced by everything from stress to pollution to poor diet, build up in the body, they damage cells and tissues, including prostate tissue. Antioxidants neutralize those free radicals before they can do harm. EGCG has been shown in multiple studies to reduce inflammation markers, inhibit the growth of abnormal cells, and support the healthy regulation of prostate tissue. Some research has even looked at EGCG in the context of prostate cancer prevention. And while I want to be careful not to overstate the findings, the direction of the evidence is consistently encouraging. Green tea extract powder is widely available, dissolves easily in hot coffee, and adds only the mildest hint of flavor. If you're already a coffee drinker, you likely won't notice it at all. The fourth ingredient I want to share with you is turmeric, specifically its active compound, curcumin. You've probably heard about turmeric for joint health or inflammation, but its benefits extend directly to the prostate as well. Curcumin is one of the most extensively studied natural anti-inflammatory compounds in the world. It works by blocking certain inflammatory signaling pathways in the body, particularly something called NF-kappa B, which is a master regulator of inflammation. When NF-kappa B is overactivated, it can drive chronic inflammation throughout the body, and research has shown that prostate tissue is particularly sensitive to this kind of sustained inflammatory signaling. By modulating that pathway, curcumin helps create an internal environment that is less hospitable to the kind of cellular stress that drives prostate enlargement and dysfunction. The challenge with curcumin is absorption. On its own, it's not well absorbed by the body, but when you combine it with black pepper, specifically a compound called piperine, absorption increases dramatically, by as much as 2,000% according to some research. So if you're adding turmeric to your coffee, make sure you're also adding a tiny pinch of black pepper. You won't taste the difference, but your body absolutely will. A golden latte-style coffee with a quarter teaspoon of turmeric, a pinch of black pepper, and a little cinnamon is actually delicious and incredibly supportive of prostate health. Speaking of black pepper, piperine itself has some interesting properties beyond just improving curcumin absorption. It appears to have its own anti-inflammatory and antioxidant effects, and some early research suggests it may have activity relevant to prostate cell regulation. It's an ingredient that does double duty, and it costs almost nothing to add to your morning routine. Now I want to spend a moment on something that doesn't get nearly enough attention in conversations about prostate health, and that's lycopene. Lycopene is the carotenoid pigment that gives tomatoes, watermelons, and pink grapefruit their red and pink color. It's one of the most potent natural antioxidants that has a specific, well-documented affinity for prostate tissue. The prostate accumulates lycopene in higher concentrations than almost any other tissue in the body, which strongly suggests that it plays a meaningful role in prostate function. Epidemiological studies have consistently found that men with higher lycopene intake have better prostate health outcomes. The Harvard Health Professionals follow-up study, which followed tens of thousands of men over many years, found that those who consumed more lycopene, particularly from cooked tomato products, had meaningfully lower rates of prostate issues. Now, you might not be putting tomatoes in your coffee, and I'm not suggesting you do. But lycopene supplements, often derived from tomato extract, are widely available and can be taken alongside your morning coffee as part of your daily routine. Alternatively, making lycopene-rich foods a regular part of your diet is one of the most evidence-backed nutritional strategies for long-term prostate health that I know of. I also want to mention beta-sitosterol, which I touched on briefly when talking about pumpkin seed oil. Beta-sitosterol is a plant sterol found in many foods: pumpkin seeds, avocados, nuts, and certain grains, and it has one of the strongest evidence bases of any natural compound for reducing BPH symptoms. A Cochrane review, which is the gold standard of scientific reviews, analyzed multiple clinical trials and found that beta-sitosterol significantly improved urinary flow and reduced residual urine volume in men with BPH. These are clinically meaningful improvements, not just theoretical ones. You can find beta-sitosterol as a standalone supplement or as part of a prostate health blend, and taking it with your morning coffee is a perfectly effective delivery method. Now I want to address something I think is really important, and that's the role of hydration and what you drink overall. I know it sounds counterintuitive. If you're already going to the bathroom too much, why would you want to drink more? But here's the thing. Dehydration actually concentrates your urine, which can irritate the bladder and prostate further. Staying well hydrated with clean water throughout the day actually helps regulate bladder function and reduce irritation. What I do recommend limiting is excessive caffeine and alcohol, especially in the evening. Both act as diuretics and can worsen nighttime urinary symptoms significantly. Your morning coffee in reasonable amounts is fine. And in fact, some research suggests that moderate coffee consumption may have mild protective effects on prostate health. But try to taper off caffeine after early afternoon and be mindful of alcohol consumption, especially in the hours before bed. I also want to talk about stress, because this one gets overlooked constantly. Chronic stress elevates cortisol, which disrupts hormonal balance, increases systemic inflammation, and has real documented effects on prostate health. The stress-prostate connection is not just theoretical. Men who carry high levels of chronic stress consistently show worse prostate symptom scores. Deep breathing, daily walks, quality sleep, meaningful social connection. These aren't soft lifestyle suggestions. They are legitimate, evidence-supported components of prostate health management. I tell every patient I work with, what you do in the quiet moments of your day matters just as much as what you put in your body. And since we're talking about morning routines, let me give you a simple, practical framework you can start tomorrow. When you wake up, before your coffee, drink a full glass of water. Then prepare your coffee however you like it. Add your saw palmetto drops if you're using them. Stir in a 1/4 teaspoon of turmeric and a tiny pinch of black pepper. If you're using pumpkin seed oil, add a teaspoon. If you're using green tea extract, add your dose. Take your other supplements, lycopene, beta-sitosterol, zinc if you're deficient, alongside your coffee. Then take 10 minutes to sit quietly. No phone, no news, no rushing. Just breathe, drink your coffee, and let your body ease into the day. That 10 minutes of stillness is not wasted time. It is investment in your nervous system, your hormonal balance, and your long-term health. I want to be honest with you about something. None of these ingredients are a replacement for working with your doctor. If you're experiencing significant urinary symptoms, pain, blood in your urine, or any symptoms that worry you, please get evaluated. Prostate health is something that deserves professional attention. What I'm sharing today is about supporting your health, not replacing medical care. These natural compounds work best as part of a comprehensive approach, one that includes regular checkups, honest conversations with your physician, and a lifestyle that gives your body what it needs to stay strong. But I also believe deeply, from decades of experience working with real patients, that the small, consistent daily choices you make are enormously powerful. The man who adds a few evidence-backed compounds to his morning coffee, who sleeps well, who manages his stress, who eats real food and stays active, that man is doing something profound for himself. He's not waiting for a problem to become a crisis. He's taking ownership of his health, one morning at a time. So let me ask you again, and please drop this in the comments because I read them. What's your biggest challenge with prostate health right now? Is it the nighttime trips? The urgency during the day? The feeling that nobody really talks about this stuff? Whatever it is, you're not alone, and there are real things you can do. Start small. Start tomorrow. Start with your morning coffee. You deserve to feel well. You deserve restful nights and energetic mornings. You deserve to know that taking care of your prostate health after 50 is not only possible, it's entirely within your reach. I'm here to help you every step of the way.